Digital single-operator cholangioscope for endoscopic retrograde appendicitis therapy. Introduction. Acute appendicitis is the most common abdominal emergency in all age groups. Endoscopic retrograde appendicitis therapy, ERAT, is a new and minimally invasive alternative method for the diagnosis and treatment of acute appendicitis, the effectiveness of which has been confirmed in a multi-center retrospective trial. The technique requires direct endoscopic imaging or fluoroscopic endoscopic retrograde appendicography to separate suspected acute appendicitis from actual acute appendicitis. For patients with appendicitis, the ERAT procedure is performed to relieve the appendiceal lumen obstruction. ERAT includes appendiceal luminal irrigation, appendiceal stone removal, and stenting for drainage when necessary. One limitation of ERAT has been the inability to directly visualize the appendiceal cavity to exclude other conditions and to accurately guide therapy. The digital single-operator cholangioscope (SOC) system is a fiber optic direct vision system typically used during endoscopic retrograde cholangiopancreatography for the treatment of bile duct stones and in the differential diagnosis of biliary stricture. The outer diameter of the cholangioscope is 3.3 millimeters, which is small enough to enter the appendiceal lumen. In this study, the authors used digital SOC in ERAT to allow direct vision of the appendiceal cavity for observation, directed irrigation, and, if necessary, lithotripsy. The instrument was introduced via the biopsy port of the colonoscope. The purpose of the study was to investigate the diagnostic and therapeutic advantages of using digital SOC for ERAT in acute appendicitis. Methods. 14 patients with acute uncomplicated simple or supportive appendicitis were evaluated between November 2018 and September 2020. The diagnosis of acute appendicitis was confirmed by direct colonoscopy imaging and cholangioscope. The success rate of digital SOC-assisted ERAT, the procedure time, postoperative length of hospital stay, complications, and recurrence rate were recorded. Result. Technical success rate was 100% with high-quality imaging of the appendiceal cavity achieved using SOC in all 14 patients. The mean procedure time was 37.8 minutes. All patients experienced immediate relief from abdominal pain after the procedure. Mean postoperative hospitalization was 1.9 days. No recurrence occurred during 2 to 24 months of follow-up. Conclusions. Digital SOC-assisted ERAT provided a feasible, safe, and effective alternative approach for diagnosis and management of acute uncomplicated appendicitis without the need for X-ray or ultrasonic guidance.